but you've been able to sustain it. So
yes,
great work there. Thank you so much.
great. Thank you.
Next, we'll welcome Dr. Deanna Tegegn from Howard University Hospital, who will present on improving MEng barcode scanning compliance in an urban academic medical center. Let's begin.
Thank you, Gail. Good morning. Today I'll be going over improving barcode scanning compliance in an academic medical center. So in general terms, I'll just speak on how we tackled barcode scanning compliance on actually a particular unit here at Howard University Hospital. As an introduction, as you're all aware, that medical related errors are quite costly and also cause harm to our patients nationwide. And the most popular medical related error is medication administration error. Therefore, we decided to see where we are at with our MAC compliance. When I say MAC, MEng, it actually stands for medication administration check. It's a Siemens product or application that allows us to use barcode scanning technology here at Howard University Hospital. So generally, to prevent medication administration related errors, most institutions have implemented barcode scanning technology, or another word, BCMA, or barcode medication administration. So this helps nurses be compliant with attending to the 5 rights during medication administration. So what we did here at Howard University was we started out with a year's worth of database to see what the charting rates of the most units were, as well as what the barcode override rate was during that time period. It was for about a year, from June 2018 to May 2019. As you can see on the screen, total charted were override was 84,319, whereas actual charted was 400. A little over 405,000. And we noticed that the non-compliance was actually 20% hospital-wide. So we decided to look at this further. First thing we did was look at what the causes or what the reason of the overriding the barcode was. And then we noticed that the most popular reasons were barcode was unreadable and no scanner was available at time of medication administration. So from there, we took a particular unit as a pilot to see what kind of intervention we need to apply to correct this non-compliance rate. So what we did was we did education on nursing units to pharmacy, as well as made sure that nurse management was involved, as well as pharmacy leadership were involved. So we took one unit, as I said, Forest, as a pilot. We looked at 732 charted incidents in July, and we noticed there was a 4% non-compliance. So again, as I have said earlier, we applied all the interventions that needed to happen, including nurse education, as I've said, made sure we work with IT to make sure barcode scanners were easily accessible to all the nurse units, made sure the medication barcodes are properly linked to the right NDC number, to the right drug code in the pharmacy. And then we looked at the same unit, again, the practices of the same unit again in November. In November, we looked at 595 charted incidents for that particular unit. And we noticed that there was only 2.6% non-compliance. So we were very excited we noticed that there was almost a 50% improvement in compliance rate with barcode scanning during medication administration. So at this point, we are continuously looking at all the units and working on assisting nursing to make sure that they are able to scan their products, their medication prior to administering to their patients. As I've said, we're working with nurses, nurse management. IT played a huge role, as well as pharmacy folks. We have a system in place where empty scannable and non-scannable items, oral medications, are returned to the pharmacy so they can be looked at again. We are sending out reports to nurse management and reviewing the report regularly to see how we can further assist with compliance with our barcode scanning MEng technology. So eventually, our primary goal will be currently due for this study was our goal was to get a less than 2% non override rate. However, eventually our primary goal is to eliminate overriding altogether or make sure it's less than 1%. And we're working towards that. Thank you.
Thanks. It's interesting. You mentioned you start out with one goal, and then as you progress, you're going to go ahead and sort of set the bar a little higher or lower in terms of medication administration and overrides. And it's interesting on the graph, you really can see that, I mean, it's just a bar chart, but you can see the dramatic reduction that you've made even so far in the count. So that's visually a sort of a way to see that. Do you have plans to conduct different kinds of studies in the future, or you think you want to keep pursuing this to make it better before you try to do something new and different?
Right now, the plan is to continue with this particular study and make sure it has gone to a point where we can then look at going to another study. But right now, we're staying with this study. We're just improving on it. As you've seen, I said now we're looking at less than 1% non-compliance, but we're still doing the same interventions. Apparently, the interventions have worked, and we're just enforcing and educating and making sure that everyone understands the purpose of MEng compliance or barcode scanning compliance, as it's a safety feature in place, and that we are all working towards a safe environment here at Howard University Hospital.
Yeah, and if as I look at the bars that you have here, that green one sort of stands out. It looks like it might be the barcode being unreadable, and it looks like you reduced it significantly. I mean, count-wise, you went from 27 to 9, but it's still a chunk. Are there particular things that you're thinking of doing to target that as an issue, or things that you did specifically around that root cause?
As I've mentioned earlier, the main thing that we did for medication barcode being non-scannable is we engaged pharmacy. Pharmacy now is also looking at the report to see if it's really a barcode issue, or is it a method of scanning issue, or maybe something else was scanned during that time, and what have you. We're working on it, as well as nursing is also engaged, whereby they send at least the oral packets that they couldn't scan back to the pharmacy. They just put it back in the patient's bin. It goes back to pharmacy. Pharmacy looks at it and attempts to scan it in the pharmacy. If there is a problem, they will correct it at that time. And if I may say so, there are some units actually who have gone days with 0% non-compliance. So it's a matter of having everyone engaged, right, from management to regular staff. And we're seeing a very successful story here. And it's just a matter of sticking to it, yeah.
And it's great to go from counting a number per day to number of days between. That's a pretty big milestone. And that's interesting. So you had talked in your talk about sort of tackling that barcode being unreadable, and now you're sort of digging into what's underneath, what's underlying that, and is that really the issue to try to tackle sort of the last vestiges of that particular cause. So
correct.
Typical plan, do, study, act, or lean, you know, any kind of those methodologies from quality perspective where we're continuing a cycle of improvement. That's great to hear. Thank you so much for sharing this. Really informative and creative work.
Thank you.